I do want to talk a little bit about how you're using telemedicine in the second opinion arena. In other words, how the physicians prepare for that appointment and how the patients should potentially prepare for that appointment, using the Care Everywhere example, if you will.
Right. Well, some people who are tuned in may not know what Care Everywhere is, so maybe I'll start with that.
Sure.
This is an innovation that has been in place for maybe 3 or 4 years in some areas, in which all the hospital systems, and this is not just in the Bay Area, this is throughout the United States, can be linked if they agree with a program called Care Everywhere, so that the records, the laboratory tests, the scans, the visit notes, the infusion center notes can be viewed by somebody else who sees that patient in real time. So, up until recently, we would have to have records sent to us, FedEx to us, fax to us, so that, for example, when I saw a patient, I could see what the primary care doctor or the primary oncologist had said in their note. I could see the results of the molecular testing and so forth. Now, when I see a patient, and this would be face to face or video visit, I can go into our Epic system, our electronic medical record, and look under Stanford and click on it and pull up the notes from one of the oncologists there or the scan report. So, for a patient who is going to get a video visit, let's say a second opinion, it's important for them to make sure that the oncologist who's going to see them in a video visit has the information that they need, and preferably ahead of time. I used to tell the patients, copy everything and bring hard copies to me, because if it doesn't get sent ahead of time, I will have it. These days, with Care Everywhere, I can see it all. And again, most institutions are part of this. The worst thing is to undergo a face to face visit or a video visit, and the person giving a second opinion says, I don't have the results of this test or the results of this scan. We're going to have to follow up so that I can look over that information. It's once again making sure that they have that needed information, what's essential to see. And with Care Everywhere, that's very easy these days in most cases.